In regards to the pre and post-operative process, our dietitians go through a thorough history and understanding of where that patient's diet and lifestyle is currently at, and maybe some of the pitfalls that can be improved upon. They also have quite a large database of information that's able to be provided to patients, including books, online learning centres, as well as going through things like meal plans and particularly dietary requirements that patients may have. In regards to our psychologists, they are such an integral part of our process. Not many clinics have psychologists in their practice, and we're very lucky to have 3 psychologists that work right here in the one space. Patients will go through screening assessments that are not meant to be punitive. They're really to gauge behavioural changes and where we can delve into some of the challenges that patients may have following treatment. In regards to the exercise physiologist, I think it's a great asset that we have here in the practice. We provide some assessments for patients before their treatment, as well as follow that up after their surgery or other weight loss treatments that they've had. The exercise physiologist also provides the patients with an app that they can then use to monitor their progress and to really step up their exercise regimes as they get further down the line. So lucky to have 3 GPs that work in the practice. They're such an integral part of the pre-operative and post-operative assessments. They go through blood tests, they go through previous medical history, medications that may need to be changed. We're really lucky to have nursing staff in our practice who are able to support patients. One of our nurses is the nurse manager of my surgical ward where I work, and we're very lucky to have that ability to provide information about those first few days in hospital and what they may look like, maybe some of the things that they may experience, and some of the strategies to overcome maybe things like pain and you know what the incisions might look like, and you know how regularly the fluids go up, and things that you may not have thought about. We also have an endocrinologist in the rooms. He is available for patients that may not have somebody who has looked over their diabetes before, who has assessed their hormones and maybe reasons why their weight has changed or they don't feel quite right. And that is a huge asset for our practice. It's very difficult to go and find an endocrinologist who understands weight and weight management. We're very lucky to have him in our practice and available to see patients.